So today I wanted to talk about a common cause of pain on the outside of the ankle. Often I'll have patients come in and they're having pain on the outside or the lateral portion of their ankle, and they won't really know what may have caused the pain. A very common cause of pain on the outside of the ankle is a ankle sprain. So what happens is a person's foot will twist basically, and it stretches and strains the ligaments around the outside of the ankle. So the most common ligament to get pulled is called the anterior talofibular ligament, or the ATF ligament. And it's right at the front of the ankle. So if you look at the bone on the outside of your ankle, right at the front of the ankle is where the ligament attaches, and so you'll have the pain towards the front of the ankle. Now you can also pull a ligament at the back of the ankle called the calcaneofibular ligament, or the CF ligament. So it'll hurt a little bit towards the bottom and back of the ankle. There's also a tendon that goes behind the outside of the ankle called the peroneal tendon that comes down and attaches to the fifth metatarsal base, the little bump on the outside of your foot. And that tendon can get aggravated or inflamed when you twist and what we call invert your ankle. But the most common is to pull the anterior talofibular ligament, or the ATF ligament. Some very common treatment is what we call rest, ice, compression, and elevation. So compression is easy to do. You can use a ACE bandage. Rest is to just get off of your foot, elevate, and stay off of the foot. Ice, you want to apply ice for the first 24 to 48 hours to the outside of the ankle. And then common treatments, often when you go to an urgent care or an ER, they'll give you an air stirrup brace to provide stability. The problem is it's a hard plastic device, so it can dig in and rub and irritate. So often I like to switch to a lace-up style ankle brace, which allows for the ankle to go up and down, but it prevents the twisting in and out. You can certainly also take anti-inflammatories, Advil, Aleve, things of that nature. Now some people come in and say, well, I don't remember twisting or turning my foot. It can be as simple as stepping off of a curb or being out in the yard. You twist your ankle, you say, and then you go on about your business, and a couple days later it really starts hurting. It doesn't have to be as obvious with swelling and bruising and bleeding. If that's there, fine. That makes it real easy to diagnose and know. Now you usually would want to come in, even if it's obvious that you sprained your ankle, to get x-rays to make sure that there's no type of break or fracture, because essentially when you twist or turn your ankle, there are two options. Either the ligament gets stretched, or you could break the bone. So if the bone is weaker, you actually could break your ankle, and we could talk about that later on some other videos. But today was just to address ankle sprains. So if you have pain on the outside of your ankle and it's been bothering you for a while or even just a few days, it's best to come in to see someone, have it checked out. You can give us a call at Watkins Foot and Ankle Clinic. The phone number is 352-805-4317.